I'll go girl, boy, so that people don't think I'm biased. And we've got at least one young lady here and one gentleman here who have microphones, so that please introduce yourself and when I call on you, and if you can stand up so everybody can see you and hear you, I will try to answer your question. This gentleman right here in the front. You can go ahead and let it go.
Yes, Mr. President. I'd like to know, we have a healthcare reform now, Medicare. Why isn't it possible for us to expand that to cover people? I mean, it's already in place.
Right. Right.
It seems like it would save a lot of costs.
Well, you are exactly right that we've got Medicare right now that covers people 65 and older. And seniors are very happy with Medicare, and rightfully so. In fact, by the way, this week is the 44th anniversary of Medicare being put in place. And you should know that the same arguments that you're hearing now about health care reform, you were hearing back then about Medicare. Everybody was saying, this is socialized medicine, government's taken over, this is terrible. Now the senior citizens will tell you they are very satisfied with Medicare, except for one exception, and that is prescription drugs, because there's still a donut hole. I'll talk about that in a second. So there is, you could say, well, why don't we just include everybody under Medicare? The problem we have is, first of all, the majority of people still get health care through private insurers, and if all we did was take the uninsured and put them into Medicare, then the costs would be so high that we couldn't pay for it, because Medicare is a pretty expensive program. Part of what we want to try to do is to actually change how the delivery systems in Medicare work to make it a little bit more efficient and to squeeze out some of the waste in it. I'll give you an example. Under Medicare, we spend about $177 billion, that's with a B, in subsidies to insurance companies who participate in something called Medicare Advantage. It's like Medicare, except private insurers manage it. And my attitude is, why are we giving $177 billion to insurance companies that are already profitable? We can use that $177 billion to cover more people, which seems like a pretty sensible thing to do. So it may be that over time, what we look at is who's eligible for Medicare, and are there ways that we can include some people who currently don't qualify. But right now, what we've proposed is to, instead of using Medicare as a model, use the kind of model of the health insurance that members of Congress have, which is not a bad deal, and basically set it up so that there's something called a health insurance exchange. If you didn't have health insurance right now, what you could do is you could go to this exchange, you could select the plan that you thought was best, which is what members of Congress do, and then you'd get a subsidy to help pay for your premiums. And because you're part of a big pool of customers, you then will have leverage and negotiating power with the insurance companies to drive down those costs so that you can afford health care and it's high quality. And we're going to make sure that the insurance companies have to abide by the rules that I just talked about. They can't prohibit you from joining because of a pre-existing condition. If you lose your job, you can still keep your health insurance. All those things that will give you some more security. What I want to do is not replace the private insurance system, but I do want to make sure that folks who don't have access to it because they don't work for a good company like Kroger, or they just work for a small business that wants to give them health insurance but can't afford it, that they're able to get the same good deal. Okay? Young lady right here. You can just pass the mics down. It's hard to get through the aisle here.
Hi, Mr. President. My name is Lisa. And I was just wondering, is this a plan that you would be willing to put your family on?
Yes. I mean, as I said, this is a plan that's similar to what I had when I was a member of Congress. Yeah, the federal employees benefit plan is, the way it basically works is that you have sort of a menu of options. You can choose the plan that you think is best, and then, you pay your premium. Now, as a member of Congress, I was making more than a lot of people are, so I didn't need a subsidy. We would have to provide some help for people so that they could afford the premiums. But the idea that you've got a big pool that gives you then leverage and the insurance companies have to compete for you, that's makes sense. I also think one of the choices that you should be able to choose from is what's called a public option. Now, this has gotten a lot of people riled up because they say, aha, see, this is government-run. When you hear people talking about us wanting to create a government-run health system, all they're really talking about is what we've proposed is to have an option that is non-for-profit. It's set up by the government and can keep administrative costs low and can keep insurance companies honest. Because if the insurance companies started jacking up their rates real high, then you could go into the public option, and those private insurers would start losing a lot of people. So they'd have to compete for you. I think that's a good idea. Some people disagree with me on this, but in terms of quality of care, yes, I would actually sign up. Now, I got to admit, just in the interest of full disclosure, as president, I've got this doctor who follows me everywhere. Seriously, and an ambulance. And so, I don't want to pretend like I don't have super duper care, but I don't think that lasts after I leave. So, all right. It's a guy's turn now. Gentleman right here.
Hello, Mr. President.
How are you, sir?
Good. I'd like to welcome you to Bristol, the birthplace of country music and the fastest half-mile track.
Fantastic.
It's an honor to have you.
I think the last time I was here, wasn't Jimmy Johnson here? I'm trying to remember. I think I mean, he came backstage to talk to me. But anyway, so I know a little bit about race. Go ahead. Oops. Is it still working?
Testing.
There you go.
Thank you. I've been fortunate to work for a company for 36 years that does have health care. But the last two contracts that my union has negotiated, we settle health care business first. If there's anything left, we get a little raise. If we don't, we don't. What do you propose to, or how can you think we could force other companies to be as responsible? When I go to the emergency room, I don't have to pay 3 times the cost because other companies are carrying the same burden that Kroger's carrying, and all the cost is not passed on to us.
Right. Well, you make a terrific point. Okay, so let me talk about this just for a second. One of the reasons that a lot of Americans aren't sure whether we should reform the health care system is they've got health insurance right now, and they're thinking, you know what, as long as I've got it, I just don't want to see any changes to it. What they don't realize is that the costs are going up for their employers at such a high rate that they are not getting raises, higher wages or higher incomes, because that money's all going into health care. Now, if you're collectively bargaining as a member of a union, then you realize that because you're in the negotiations and the employer puts it in front of you and says, look, what can I do? Our health care costs just went up 20%. Here's my margins. Here's my profit. I just don't have enough money to give bigger raises. And so, but a lot of people don't realize that. This is one of the reasons, by the way, that wages and incomes have been flat for everybody except the top wealthiest Americans over the last 10 years. Even before this recession hit, people were not getting raises. They weren't getting higher wages and incomes, partly because a lot of it was being gobbled up by health care. So if we can control health care costs, that will free up more money for higher wages, higher salaries. But you're right that part of controlling costs is making sure that we're not paying for other folks who don't have health insurance because their employers aren't doing the right thing. Now, that's very important.